it recording? Okay, there we go. Hi, everyone. So today is January 12th, 2021. It's a Tuesday, and my name is Michelle Grimolia. I am the president and CEO here at Woodland Pond, and this is a very exciting day. My last broadcast was excitement regarding vaccines that were happening in our skilled nursing unit for the residents, and then for all of our first staff members that wanted to be vaccinated. And today we're going to talk more about vaccinating our assisted living residents, our Garden View residents, remaining staff members, independent living residents, board members if they're interested because they count as staff, and approved caregivers. So lots to cover today. I am going to try my best to talk slowly because there's going to be a lot of detail in today's broadcast. I will certainly be following all of this with a memo. And I also believe that normally I do a broadcast on Tuesdays and Fridays. This week, I think I'm going to plan on adding one possibly tomorrow, which is Wednesday and Thursday. But one of the 2 days for sure, because I want to make sure that all residents have an opportunity to understand the latest details on the vaccination process, steps, and instructions. So stay tuned to your calendar and Connected Living, because we may be adding a broadcast. As usual, this broadcast will be available on our YouTube channel, and I will send this out in a link after we are done today, so that those that don't have Spectrum or our closed circuit television channel can certainly access the information. So before we get into vaccine information, I just wanted to mention a few things today that my department heads have asked of all residents. First and foremost, I want to again thank all of the residents that have volunteered to man our mailroom. It's going better than it was last week, and you know, my leadership members are letting me know that you guys are doing a great job making sure that people are staying in their lines and only going into the mailroom one at a time. But there is seeming to be a tendency that while you are sitting there, your friends are coming to visit you, and those visits are happening far too close. The 6 feet is not being maintained consistently. So for the friends of the people that are manning the mailroom, if you could please let that person do their job and make sure that you're leaving the 6 feet distance again. And we're going to reiterate this so much over the next coming months while we reopen the campus after vaccination. 6 feet distance is going to have to continue to be maintained. And 6 feet distance is the distance of your entire arm's length, so that whole arm, plus the person that you're talking to arm. So both of you need to be able to put your arm completely out, you know, and neither one would be able to touch. So that's 6 feet. We need to keep that in mind. I have gotten, some of you have gotten in touch with me about some of your general grumbling about life at Woodland Pond right now. We get it. Everyone is testy. Everybody's grumpy. We're tired of, you know, not having things available to us, both here on campus and out in the world. One of the things that concerns me is that some of you are coming to me about a timely matter. Let's say, you know, you notice that this light bulb is out, or, you know, you're concerned about the front door being locked, and then you're adding in, and oh, by the way, I'm sick of the food. I review every single comment that we get on the food and on the meals. What I have to ask of you is that the meal issue or concerns about your meals should not be added on to, you know, as an aside with a light bulb comment. The meal feedback is probably one of the most important things that we need from all of you. So please don't wait until you have a light bulb out to let us know that you are not satisfied with the meals. We are doing everything we can to try and satisfy as many of you as possible. It's the most helpful for all of us that when you have a problem with a meal or a concern about the quality of the food or anything like that, that you let us know right away in writing. Okay, so either a written comment on a piece of paper or an email, And Ronnie gets them. She goes over every single one with her team. I get every single one. They also go to the dining committee. We don't want this to be an aside. We aren't accepting a subpar quality of food. None of us want that. So if you are feeling discouraged, down, frustrated with the meal service, please continue to provide that feedback when you have the problem, because we have the ability to make changes. Ronnie is hungry to do so. No pun intended. But it shouldn't be an aside, when you have a problem with your phone and then, oh, by the way, I'm sick of the food. We want to know the food issues when they happen. We want the opportunity to make it better for you, to give you the alternatives. And you shouldn't assume that, what is has to be. That's completely not the case. We have a lot of options. So please get us that feedback on the meals. For those of you that do not email, I think that you're probably understanding and starting to see that more and more. The most expeditious way that Woodland Pond is communicating with you, or your neighbors are communicating with you, all can be via email. We are most likely going to be resuming the services of Cassidy in her role as resident technology assistant, and we really want to see many of you up and using email. It's very straightforward. We can make it very simple for you on your devices. We do have loaner technology devices. We don't want you to feel overwhelmed and intimidated. Email can be very simple, and it's a really great way to communicate. It's by far the fastest way that I can get in touch with you all, get information in your hands. We want you to get comfortable with jumping on your computer and checking your email every day. Your family can send you photographs and jokes and all kinds of things. So we are going to be really working with those that are interested in getting on email. If you're interested, definitely give the concierge a call. I know that the Residents Council did a survey not that long ago, and we have a good sense of it, but we really want to get that going. And the last thing I just want to mention from a non-vaccine related perspective is that in the Chanticleer this week, you did see that there is a section sort of in the middle there coming from the Residents Council. And this is an endorsement by the Residents Council and at the behest of a number of your neighbors that we have an advocacy opportunity right now here on campus. Many of you are home and maybe not as busy as you were a year ago and looking for things to do. And many of you have neighbors, friends, people that you consider to be loved ones in the health center. And those people cannot have visitors now by regulation. So in independent living, the campus is closed to visitors because there's a high risk of COVID right now. But as soon as we get vaccinated and as soon as that high risk reduces a little bit here in Ulster County, we anticipate being able to open up for visitors again. In the health center, it's not so easy though, because that visitation restriction is by virtue of an executive order of Governor Cuomo and his team. So many residents, as reported with the information, the Chanticleer by the Residents Council, have decided that they're going to turn their downtime into active time and meaningful time, and writing letters to and making phone calls to and sending emails to our governor in New York and also some local legislative representatives to demand that there be some leniency available to skilled nursing and assisted living and Garden View residents in terms of having visitors. There is no doubt that the quality of life for folks that are not allowed to see their loved ones is diminished. And although, independent living certainly is being done by myself, my team, and our infection control determinants based on risk profile, we have more wiggle room here and we can make some exceptions. In the health center, oftentimes folks are facing significant life-changing illness, and there is the risk that someone in skilled nursing, if they are not able to see their loved one, may not see them again. I hate to say it in those terms, but there is a difference between independent living and even myself and then the folks in the health center. And so if you're interested in advocating for the rights of our residents to be able to have visitors more freely, particularly in light of the fact that vaccinations are on the rise, and we do have rapid testing technology on hand here on campus. Please write a letter. Please send an email, or please make a phone call. There's nothing better to use your time for, some would say. This is to literally enhance the quality of life of your neighbors. So look at the Chanticleer for the information on how to contact the powers that be in making those decisions. Okay, so now vaccines. First, an update on how the aftermath of last week's vaccine clinic has gone. So we vaccinated 107 voluntary staff members. I cannot thank those staff members enough. You are really just showing that, you know, it's health first, and, you know, excitement and enthusiasm for the future. So congrats to those staff members that got our vaccines, myself included. We had less than a handful of folks report any kind of side effects at all, and those that did were exceedingly minor. We had a couple of headaches. A number of us, myself included, had a sore arm on Saturday, and only on Saturday after being vaccinated on Friday with the Pfizer vaccine, the first dose. I always personally get a sore arm from the flu vaccine, so for me this was not unexpected. There was no bruising or anything like that. 0% of the 31 residents in skilled nursing that received the vaccine had any side effects at all. So we are just thrilled with the outcome of that first vaccine clinic. And all of the folks that were vaccinated on the 8th will be vaccinated with their second dose on January 29th. Moving on to assisted living and Garden View and our next staff clinic available. All of the residents of assisted living and Garden View who have personally opted for the vaccine, or whose representative has consented for the vaccine, will be vaccinated here on campus, also by CVS, as was done with skilled nursing, and also with the Pfizer vaccine on January 24th, which is a Sunday. And all of the staff members that additionally would like to be vaccinated newly, so not folks that were vaccinated on the 8th, but those that would like to be in the second round, will also be vaccinated on the 24th. And that will be repeated, those folks will be repeated 3 weeks after that, which will be on Valentine's Day, February 14th. So very exciting news there. We're hoping we get a bunch of, if not all, of the assisted living and Garden View residents. As you all know, 100% of the eligible skilled nursing residents that were able to be vaccinated were last Friday. We're hoping for a very similar outcome in assisted living and Garden View, and as many staff members as are willing to be vaccinated. So we're very excited about that. Okay, so now on to independent living vaccine. So I want to just take a few moments to talk about where we are up until today, and then what's going to happen over the rest of the course of this week. So initially, Governor Cuomo had not included, and the federal government had not included generally healthy but over age 75 people in phase 1 for vaccines. As of last Friday, Governor Cuomo added folks over age 75 to phase 1, and this is phase 1B, meaning that at that point in time on Friday, when that announcement was made, that opened the availability of anyone that can access a vaccine that is over age 75 to indeed be vaccinated, which was great. The ironic part of this is that it doesn't come with inventories or supplies of vaccines. So all afternoon Friday, Saturday morning, all day Sunday, you know, residents excitedly were reaching out to me. The adult children of our residents were reaching out to me to say, okay, let's get everybody vaccinated in independent living. But it's not that simple because we don't have vaccine. So what I had reported last week and the prior weeks still was the case. We had immediately, when vaccines started back in December, contacted the county health department here in Ulster County, as well as the New York State Health Department, Dedrick's Pharmacy, who partners with us frequently on these types of things. And as well, I contacted Moderna directly through a personal connection to find out if we could purchase or access vaccines for independent living. And none of those supplies have materialized at this point. So when the announcement came out on Friday that independent living folks that are over age 75 would be able to be vaccinated, we were excited, but we still had no vaccine. So over the weekend, one of my colleagues and actually a co-hockey mom who is the practice director for the Institute for Family Health, and she oversees all 33 of their locations, but is centralized out of New Paltz here. She and I chatted on Sunday, and it turns out that they are actually able to provide vaccination for all of our independent living residents and approved caregivers that are interested in being vaccinated. So that's very exciting. I'd like to personally thank Erica Caliendo for all of your efforts on this. It's been tireless so far since Sunday, and I know the next 7 days as we get through this is going to be a lot. So I really appreciate everything, Erica, and as well everything that the Institute is going to do to get our independent living residents vaccinated. So the Institute for Family Health is right here on the corner of North Putt Corners Road and Route 299. So for those that are here on campus, if you were to come out of the front entrance and take a right and head towards New Paltz or the Thruway, the Institute is right there on the corner. It's set back a little bit from the road. It's a big stone building. You would recognize it's 2 stories. LabCorp is there upstairs. I'm sure many of you have been there. So you're certainly familiar with the location. It's just about a third of a mile down the road. So it's a nice jump to that location. And that is where our independent living residents and approved caregivers that wish to be vaccinated will be done so on Saturday of this weekend and Sunday. So, of course, initially we had, when Erica and I were talking, we talked about the opportunity for all of you to be vaccinated here on campus through some kind of a relationship with the Institute for Family Health. And Erica did confirm and did double check, but they are not permitted to remove their vaccine supply from their location. So we cannot do independent living vaccines here on campus at this time because we don't personally have any supply of vaccine, and the Family Health Institute can't come off campus with their vaccine. So we have to get all of you to the Institute for Family Health to get vaccinated. It's just, as I said, a third of a mile down the road. It's about a 3-minute drive. It'll be great. So how is this going to work? The Institute, as I will refer to it throughout the rest of this broadcast and in future memos, is closed to the public, closed at all in general on Saturdays and Sundays typically. Erica has offered to very graciously open the clinic with all appropriate staff. It's not just going to be Erica at the Institute. She's going to have all of her medical staff that are needed, all of the administrative staff, plenty of people on hand on Saturday and Sunday of this weekend. We are going to begin vaccinations there on campus or at her site at 10 a.m. on Saturday, and the last person will be done by 5 p.m. and we're going to repeat that on Sunday. So again, the vaccinations themselves will happen at the Family Health Institute or the Institute for Family Health, interchangeable name, right here on the corner of North Putt and 299, and that will be this Saturday and Sunday. This is completely voluntary and optional for all residents and approved caregivers. So we have contacted at this point, either via my email yesterday, or you have heard either from Cassidy or Marissa or another concierge staff member. You have been contacted if you live in independent living to find out if you're interested in participating in this vaccination process this weekend. We have asked you if you wish to be vaccinated and if you will need transportation, because both things are a factor, of course. For those that have asked, and I did indicate this in my memo yesterday, this is the Moderna vaccine, and it is a 2-dose vaccine. So everything that we do and arrange for this weekend will be repeated in 3 weeks. because that is the protocol that's required for the Moderna vaccine. Same as the Pfizer vaccine that our staff is getting and that the health center residents are getting. So we're going to get everything set for this weekend, and then all of that's going to repeat 3 weeks from them. From that point in time, from the point of the second dose, which will be 3 weeks from this weekend, 2 weeks after that is when you are considered to be essentially inoculated or vaccinated. So this weekend will start off what is essentially a 5-week vaccination timeframe. So you'll have your first vaccine this weekend, if you're choosing to do so. Then you will have your second vaccine 3 weeks after that, and then 2 weeks after that date, you will be considered to be vaccinated fully. Although vaccination really does, and inoculation immunization does begin with the first dose. So not to worry, you are going to get a nice boost from this weekend's dose if you are planning on getting vaccinated. So as I said, you have now heard from us if you are in independent living and you have been asked if you would like to be vaccinated, and you have been asked if you will need a ride. Hopefully you have been asked or you've indicated if you have an approved caregiver, if they would like to be vaccinated. We will be reaching out to all of the approved caregivers that we do not have information on to get them on the list as well. So not to worry. Got lots of hands on deck trying to make sure that we get all of the information situated for Saturday and Sunday. We will ask everyone that can ride in their own car. So either you drive yourself or you drive you and your significant other, your spouse, or you ride with your approved caregiver or your approved caregiver rides with you. Anyone that can arrange for private transportation to please do so, and then we notify us. We cannot have residents riding together in the same vehicles though, however, if you do not reside in the same household. So nothing has changed in that regard. Neighbors cannot ride together, friends cannot ride together, just those that live in the same household, those that are significant others that may live in different households but are significant others, and those that are in an approved caregiver role can transport in the same vehicle, a private vehicle. Otherwise, we're going to need to transport you with our transportation. So how are we going to do this? Right now, and I just checked in with Cassidy, we have approximately 240 people that want to be vaccinated this weekend, which is amazing. And also an amazing logistical challenge. So this afternoon, after I'm done with this broadcast, I'm going to tie up a couple of other business-related loose ends, and then I'm going to be sitting down, and Jason will work with me, and we are going to come up with a schedule that slots in all of those 240 people, plus maybe, over the course of the weekend in prescribed time slots. As of right now, we believe that each of you will be assigned a time slot that begins on the half an hour. So we're going to have a group that starts at 10 a.m., a group that starts at 10:30, and so forth, all the way throughout the day on Saturday, and then all the way throughout the day on Sunday. There are a few things that we, of course, need to take into account while we put the schedule together. So first and foremost is transportation. Jason will have 3 drivers on campus on Saturday and Sunday, plus he will be here if needed. And we'll have 3 vehicles available because we cannot have residents congregating on the Woodland Pond vehicles. Just as you cannot congregate in a private vehicle, we also can't have you unsafely congregating in a Woodland Pond vehicle because we haven't been vaccinated yet. So Jason has to be really careful about making sure that as we schedule each slot of, or each group of people to be vaccinated and sent over to the Health Institute, that the transportation is done safely and that we're not introducing a risk of cross-transmission of any kind of illness or virus. So first and foremost, that's why it's so important that we have as many people that can drive themselves to do so, or to get rides with their approved caregivers, but also likewise that we know exactly who will need transportation. Because as we put the schedule together, we have to find a mix in every single time slot of people that can drive themselves and people that need transportation, because we simply cannot transport 10 at a time with the 3 vehicles. So each time slot will be a mix of people that are driving themselves and people that need rides. So that's one consideration. The next consideration, of course, is, how many people are in your group. So some of you, you may be a couple and you may have 2 approved caregivers and all 4 of you wish to be vaccinated. We are going to do everything that we can to have all 4 of you be in the same time slot. So there's going to be quite a bit of logistics in putting the schedule together. So again, this morning and yesterday was to get a sense of who would like the vaccine, and we're going to take that information and build it into an inoculation and transportation schedule that spans over the course of this weekend. So that is step 1. Once we have that schedule set, the next step will be to provide each of you your assigned time. And I'm still working through that mentally, but I think what it's going to be is it's going to be certainly a written assignment sheet. We'll probably use a special color piece of paper and ask you to hang it on your refrigerator as soon as you get it, or hang it on a cabinet so that it doesn't get lost. So that you've got it right there and you know exactly when you need to come down to the lobby if we're bringing you, what time you should plan on getting on the bus, and then what time we will bring you over to the Family Health Institute. We will also be communicating this in other ways. We will have it via email. We'll send it to you if we have your email address. Certainly, we will have this information be available to the loved ones of our residents as helpful with reminder. We're going to need everybody to just keep reminding and reaffirming and all that kind of stuff over the rest of this week so that we make sure that everybody's ready to roll. So we're going to get you your information about when your appointment is going to be. And then most importantly, we are going to get you some instructions. There are some steps that have to be taken before we can send anybody over for the vaccine. There is some information that has to be collected in accordance with New York State regulation. And there's also some information that the Institute needs. So, it's your typical demographic information, name, age, address, phone number, insurance information. All of that we have generally on hand because of, we do collect that when you move into Woodland Pond. But where we have gaps in that information, we're going to have to collect that from you. And likewise, we are going to have to help all of you complete the New York State forms. Some of them are online. I don't want you to become overwhelmed with that today. Because the first order of business for today and tomorrow, first and foremost, is to get that schedule set. Tomorrow, we will go through the instructions for what has to happen. And Cassidy will be working full-time on Wednesday, Thursday, and Friday to help every resident that needs assistance with this. We're going to ask your kids to help. We're going to ask your loved ones to help. We're going to get this done, but it's definitely going to be a group effort. But the first building block to this is getting that schedule set and communicated to the Health Institute and communicated to you, and Jason feeling comfortable with the transportation. So step 1 is the schedule. So we talked about the fact that this is the Pfizer vaccine. I just want to let you know a little bit about what to expect. So on Saturday or Sunday, whichever day you are assigned your time, it's going to be very important for you that morning and throughout the course of that day to follow all of your normal routines, including taking any normally prescribed medications. Certainly you should have something to eat. You should have plenty of water. Make sure that you drink because none of this requires fasting. You need to be as strong and ready and healthy as you can. A lot of you haven't been off campus in quite a while. It's an exciting day, but probably will bring stress. So we're going to try to ask you to try to get a good night's sleep the night before. Make sure that you're eating and drinking as normal, taking your medications. All of these things will be in the instructions, and we'll just keep reiterating this over the next several days. We will transport you safely, or you will take your own transportation to the Institute. And then once you arrive on campus there, the Institute, again, is completely closed to the public. So the only people that will be there are those that work there and then our residents. The building is extremely accessible. So for those that either have a walker or wheeled transportation or power mobility, you certainly, if you need that for safe transport, should plan on utilizing that. And there will be, it's handicapped accessible at that location. So there's no worries there. It is a medical practice. Of course, they're following all safety standards and protocols at this time and have been throughout COVID. It's a very safe environment, and you don't need to worry about that. Currently, and we are anxiously awaiting clarification and approval from the governor's office, but currently phase 1B does not cover residents of independent living that are under age 75. We are working as hard as we can around the clock right now to get dispensation to have all independent living residents approved under the auspices of having lived in a congregate setting. The challenge is that the Department of Health and the governor's office do not consider independent living necessarily congregate. They consider it to be more like an apartment building, because you each have your own distinct, fully enclosed or fully equipped homes. It's different than skilled nursing where there's no kitchen, there's no shower, etc. That's all congregate. So independent living, it truly is. You could just stay self-contained in your home. So we're working through that. What we are doing is for anybody that's under age 75 that has asked to be included for the vaccine, we're marking you down, and then as we get closer through the end of the week, we're going to keep you on the schedule, and then, hope and keep our fingers crossed that this goes through. I'm optimistic that this will happen, but I cannot say for sure. So for right now, again, we are slotting in those that are under age 75 that wish to be vaccinated. But as of today, you are not considered to be in phase 1B, but we are working on clarification for that. If you are currently on quarantine because you have attended a funeral or had a medical procedure off campus or had a fall and required EMS transport, you are actually able to go for this vaccination. And if for any reason any of you are quarantined because you have symptoms of illness, you will not be able to attend your vaccination session. So for those that are on quarantine because you went off campus for the holidays or had a medical procedure, etc., you will be able to attend your vaccination. We just may schedule these a little bit differently, and that's for myself and Jason and Mary Jo to figure out. In terms of who is qualified for the vaccination, you will be pre-screened upon arrival by the Family Health Institute staff. The general guidance from the CDC is that the only folks that are of concern with getting the vaccine are folks that have serious medical conditions where your physician would counter-indicate the vaccine. So if you have any questions at all about whether or not you should be vaccinated, you should be contacting your primary care physician. I can't make that decision. Mary Jo can't make that decision. The folks at the Institute should not be put in a position to make the decision about you unless you are their patient. So if you have any questions at all about whether or not you should be vaccinated based on your health condition, please call your primary care physician today, if possible, to get clarity from them. Otherwise, the one area of concern is for those people that have had a prior history of anaphylactic reaction to an injected vaccine or medication in the past. So this is not an anaphylactic reaction to an oral medication or to a food item or an environmental allergy. So if you've had anaphylaxis because of a bee sting, that should not preclude you from having this vaccine. But if you have had an injected medication or a vaccine in the past and you have had an anaphylactic reaction, that would be cause for concern, and you definitely should be calling your physician to find out if you should have this vaccine or not. In terms of reaction and just generalized post-vaccine considerations, we've talked about that. One thing that I will share with you, and this is just truly Woodland Pond, right, is Mary Jo actually will be here on campus on Saturday and Sunday. So that's our wellness registered nurse, Mary Jo. And she's actually going to stay over here in our guest suite on Saturday night and Sunday night, so that anybody that is concerned about, gosh, what if I develop a symptom overnight, or if I get concerned, Mary Jo will be here. So she's such a sweetheart. As you know, she cares about you all so deeply. So she's going to stay over here on Saturday night and be here just in case, on the outside chance that there is something that happens. And of course, we have right here, not even a quarter of a mile away, the New Paltz Rescue Squad. So you're in really good hands. This is going to be a great vaccination rollout. Let's see. For caregivers, if you are a caregiver and you do wish to be vaccinated, you are absolutely going to have your Woodland Pond badge with you. So you are going to have to come to campus before you go straight to the Institute, and this will be in the instructions, because you're going to have to get screened here, pick up your badge, and then go to the Family Health Institute with your badge, because you're being covered as a caregiver, a healthcare provider, caregiver here in New York State. And once you're done, you will bring your badge back, and we'll make sure that you have those instructions. I think, let's see. But the other thing I just wanted to mention, I'm sure there's a couple more things, but one thing I do want to mention is that because this is from today, really a 5 to 6 week now process. You'll all be vaccinated this weekend that want to be. Then you have to wait 3 weeks to get vaccinated with your second dose. And then it's another 2 weeks until it's considered to be completely, fully vaccinated. None of the protocols on campus are going to change at this time. It's our hope. And I will tell you, just briefly looking at the numbers, we have at least 90% of you that want to get vaccinated at this point, which is just, it's remarkable. And it's very exciting. The goal is that after the 5 or 6 weeks that have passed, that we be able to resume as many safe, with masks on and 6 feet distance and all that, congregate activity again. That means card games and meetings and the dining room being back open. So that's our goal here. The goal is the more that get vaccinated, the more we can get back to life as usual at Woodland Pond, get our vim and our vigor and our vibrancy back. And for all of those residents that have had the fortunate misfortune of moving into Woodland Pond in the last 10 months, you have so much to be excited about. The community awaits you. The life that will come back into the community will be like opening a dam once we get through the vaccination process and out of the woods here with the high risk COVID post holidays. But for the initial period of time, nothing will change. We'll still all have to wear our masks. We'll still have to not do congregate activity for another several weeks. But this is the light at the end of the tunnel, and this is the ticket to how we're going to be able to open the community back up to visitors and so forth. And I believe, mainly we're talking about independent living today, but it is my inclination that the governor intends to look at each facility from a skilled nursing and assisted living perspective to determine the propensity or the proportion of folks that have been vaccinated, and then make decisions about reopening those higher levels of care as well, based on, in some part, vaccination numbers, but also, how pervasive COVID is in your region. So this is a step towards getting back to the life that we all so richly miss and deserve. The last thing I just wanted to mention before I get into getting back to my working on the schedule is this vaccination is free of charge to all that want to have it. The Family Health Institute does charge a nominal fee for administration, which will either be charged to your insurance or charged to Woodland Pond. So you should not have any out-of-pocket costs on this, whether you're insured or not. So I know some of our caregivers may have insurance through the exchange, or maybe are not insured. You don't need to worry about that. This vaccine is not going to cost you anything, and I hope that that's not an impediment to anyone choosing not to be vaccinated. So you all know how to get in touch with me. I know this has been a very lengthy update today. I appreciate you paying attention and staying awake, but this is extremely important stuff. Everything will be followed with in-writing instructions, and I will plan to revisit this tomorrow at noon with a weekly update or a daily update, and I'll do the same on Thursday and Friday as well. Then this way I can address any questions that come up over the course of the next 24 hours. We'll keep you guys in the loop. You can call me at my desk. It's extension 5501 if you're here on campus. You know how to get in touch with me on email. And really, really excited about this. We will see you all tomorrow, same time, same place. Thanks.